you want to do is before you do any procedure on any patient or anything to a patient is you're going to want to wash your hands, and you're going to want to check your patient with 2 patient identifiers. Typically you have a site scrub, you have your syringe, and you have your little buffalo cap site. This is the nephrostomy tube site or the collection bag where all the fluid typically goes. You're going to want to put some gloves on. And while you're doing this, you're going to want to be talking to your patient, kind of telling them basically how things are going to feel, and just having them communicate with you and you communicate with them. So the reason we do this, we can do this every 12 hours or depending upon what the physician wants, but we do this to keep this tube cleaned out so we don't have any occlusions. We use a site scrub. We are going to take this little buffalo cap site and we're going to swab it. Take it down. And then we are going to let this dry for about 15 seconds. This is your syringe full of normal saline. Usually about 10 cc's is good enough for you. You will go ahead and if you notice right here there's an off button, or not an off button, it's actually an off turning thing, I guess you would say. And you would just turn this part off. After that, you're going to take your syringe. Make sure that this end is sterile, and you are going to connect it in, twist it, and you are going to go ahead and flush gently and slowly, making sure that you are not hurting your patient, and making sure that you don't have any occlusion or any, what's the word we're looking for? Resistance, that's what we're looking for. Okay. After that's all said and done, usually what I do is I turn this off here, and what typically you'll see some of this fluid and it'll come right to that bag. After that, you'll want to wash your hands again, throw your gloves away, and document the procedure.